My name is Anthony Mollano. I'm a hand surgeon at Concord Orthopaedics. I've been in practice here for 9 years, and I see patients in Concord and New London and in Derry. Went to college in New York City at Columbia University and studied biochemistry. Then I went to medical school in Rochester, New York at the University of Rochester. That's where I first learned about Concord Orthopaedics. There's a lot of doctors that trained at the University of Rochester that work at Concord Orthopaedics. So I heard of different doctors like Dr. Woods and Dr. Clark. I did my orthopedics residency in Iowa City at the University of Iowa Hospitals and Clinics. And that was a 5-year orthopedic surgery residency. And after that, hand surgery training was 1 year. I did that in New York City at the Cornell University Hospitals, at the Hospital for Special Surgery, which was what I did for a year prior to starting practice here in New Hampshire. What's really amazing about being a hand surgeon is our interests are a lot of different areas that are taking care of nerve injuries, joint problems, bone problems, fractures, trauma, arthritis, all related to the hand, the wrist, and the elbow, basically even from below the shoulder. And so my interest in hand surgery involved taking care of fractures like scaphoid fractures, radius fractures, as well as nerve conditions like nerve injuries and carpal tunnel syndrome, and arthritis too, like thumb arthritis, wrist arthritis, arthritis in multiple different joints in the elbow, wrist, and hand. I went into hand surgery mainly because I initially knew that hand surgeons helped my dad. My dad he came from Italy, and he was a mason since the age of 12, and he had terrible carpal tunnel syndrome, and it limited him and impaired him, and he couldn't really work being a mason for as long as he wanted to. He had terrible carpal tunnel that he ignored, and he had hand surgery that helped it get a little better. But I knew about hand surgery since he needed hand surgery to just try to do the work that he did. So I went to hand surgery because I wanted to help people like my dad, who were laborers and mechanically inclined people that needed to use their hands. I ultimately really enjoy in hand surgery most taking care of a lot of different conditions, different injuries, people of all ages. So there's pediatric conditions that as a hand surgeon I take care of, like splitting two fingers when they're connected at birth even, or taking care of arthritis and joint replacements in very elderly patients, and then everything in between in middle-aged patients, such as different fractures and accidents and injuries. My practice philosophy is to listen to patients and help them understand what condition they have, and to offer them all the different options that exist that would help them feel better, get better, function better, whether it's for their work or for sport or simply for quality of life and activities of daily living. I have 2 children and a lovely wife. My children are 2 boys. They're 12 and 9, Theodore and Conrad. So outside of work, I usually spend time doing whatever hobbies or activities they're doing, like their different sports or different after-school things that they have. But I like spending time with them hiking and doing things outside when we can, like skiing in the winter and fishing in the summer.